Are you suffering with sciatica pain that makes it hard to get through the day, much less be active? This is the one video that you need to be able to get out of pain, get rid of sciatica, and get back to living your life. In this video, we're gonna fix sciatica from your own home in 5 easy steps. Step number 1, we're gonna roll out the glute. Our sciatic nerve is going right here, coming out of our spine and going down our butt, right down the leg right here in the back. If we're gonna loosen that up, we've got a corkscrew. It's really tight right here. We need to loosen up that muscle tissue. If you poke in right here, it's gonna be really tender. Go ahead and try that right now. Poke right here on the side of your glute and feel how tender that is. Those are the areas we want to work on, and it doesn't feel good, but after you loosen it up, you're gonna feel a lot better. So I want to take this lacrosse ball and I'm gonna put right here, right above where this hip bone is, and I put it roughly on your belt loop. I'm gonna do it up against the wall. I want it to be off to the side though. So when I set this up, I'll do it on this side. I'm gonna put it up against the wall right here, and I'm turning out. What I see often is that people put it right here behind their back, and they're pushing on that nerve. And that's why this doesn't work, is that they're irritating that nerve. We wanna make sure that we're loosening up the muscle tissue around the nerve, and that's over here off to the side. So I put my ball right here. I'm perpendicular with the ball, or with the wall, and then I'm gonna turn just about 30 degrees, just turn it open, and I'm gonna unweight this leg right here. So I'm putting pressure right there into the glute, and I'm loosening up that muscle. I don't wanna wiggle through my back. That's gonna make things worse. When you're dealing with sciatica pain like this, where it's really irritating you and you can't escape it, it can be so frustrating. All we need to do is loosen up these muscles. This is step number 1. So let's make sure that we're loosening up those muscles. We unweight this leg, and I'm gonna spend 1 minute. If you can make it to 2 minutes, we're gonna find different spots. So I'm in one spot just resting into it for 30 seconds, and then I'm gonna just move my body just slightly back without twisting up in my back, and I'm gonna dig into that other spot right here on the side for another 30 seconds. At least a minute, but if you can find 4 spots and do it for 2 minutes, that's gonna be ideal. On to step number 2. Step number 2, we're gonna loosen up the hamstring. So right here where that sciatic nerve is going through, I wanna loosen up those muscles. So I'm gonna loosen up on the right side of the muscle and on the inside, the outside and the inside. So I'm gonna take my lacrosse ball. I need a chair for this one, but you have that at your house. If you can do it on your countertop, it's really effective because that countertop is hard. We need a hard chair so we can get pressure into it. The countertop is best. If you have long legs, then your feet are gonna be touching the ground. If you get on the countertop, you're gonna have more space. So I'm gonna show you here on the chair. I'm gonna put pressure. I wanna put it right here underneath the hamstring. Remember, if any of this stuff lights you up and irritates that nerve, then it's counterproductive. So I don't want to be directly on the nerve. I want to be off to the side. So I'm putting pressure right here, loosening up that muscle, and I'm going to do 10 swipes. So when I talk about swipes, I'm talking about just straightening my leg out 10 times. I also don't want to fold up in my back, and I don't want to be extended in my back. That's going to close down the space for the nerve. I wanna make sure I'm maximizing the space for that nerve, and I do that by standing in a neutral position with my spine, and then I'm putting pressure with my hand straight down into the ball, and I'm straightening out. If you find that this is tender and painful, it is, but it shouldn't be reproducing the pain going down into the nerve. It should be a little bit tender on that spot because that's muscle tissue that's bound up and it's stuck around the nerve. It's pulling on the nerve. We want to decrease that tension on that nerve so it can start gliding around well. And so now I'm going to move it right over here to the inside of my hamstring. So I'll do it on this leg. You can see it right here. And I'm putting pressure down into it, and I'm just straightening out. I need to go over just a little bit more to get more pressure. And there, that's a little bit tender right there. So you know you're doing it right if it's tender, but it's not reproducing the pain going down your leg. We wanna make sure we're not doing that. I put pressure right here. I'm just extending out and I'm loosening up that muscle tissue exactly where we need it to be, and that's loosening up that nerve so it can start to glide around better. In the exercise that we're doing after this, we're gonna actually get that nerve, we're gonna force that nerve to glide around more and more effectively. So we've gotta loosen it up, then we gotta get blood flow, and we gotta get those nerves to glide around if we're gonna get that long-term improvement that you're looking for. And step number 3, we need to roll out our calf. That's where that nerve is coming through. And the nerve bifurcates, it opens up a lot in the calf. And so we can get a lot of tissue hung up, especially if we're not using our glutes enough. If we're not using our glutes enough when we're walking around, we're gonna overwork and overuse our calves. And that's gonna cause us big problems because when we overwork them, they're tight all the time. They're pulling on that nerve. So we're just following that nerve down the pathway of the leg and making sure that we're loosening it up so it can start to glide. We set it up where that nerve can glide, then we make it glide, and you're gonna be feeling a heck of a lot better really quick. Make sure that you subscribe to the channel so that you don't miss out on these videos, because we're teaching you exactly what we do here in the clinic with our clients. We have a 94% success rate. We fix everybody that has these problems with sciatica, and we're teaching you exactly what we do with our clients. So make sure you hit the subscribe button and hit the bell icon so you get notified when we post new videos, because they're not coming out as quickly as we would want them to. We're making sure that they're quality videos and you're getting action steps on exactly how to get yourself out of pain. So step number 3 is that we're rolling out right here. So on a chair or a bench, what I'm gonna do is I'm getting my leg up on it, and then I'm putting pressure down into it. You don't have to have a fancy roller like this. You can just use a rolling pin for rolling dough. It works just the same as this one would. So I'm putting pressure down here into the calf, and then I'm just gliding back. So I'm putting pressure on it, and I'm staying in one spot. I'm moving about 1 to 2 inches on the inside of the calf. I'm doing that 10 times. And then I'm moving about 1 to 2 inches on the middle of the calf. I'm doing that 10 times. And then on the outside of the calf, same thing. I'm gonna do it 10 times. And for me, I'm much more tender on the outside of the calf right here. So that tells me that's an area that I want to work on more. I wanna loosen up more of that tissue because I'm getting that pull, my nerve is getting hung up, and I need to loosen that up. When I get down to here, I'm going right in the middle of the calf, right here going down. So that's my 4th spot on the calf, loosening that up. I'm not looking, this is the one that's most tender on me, so I may spend a little bit more time on the outside of that calf. But remember, you're not trying to kill yourself. You're not trying to make it extremely tender. We want to be consistent with these exercises. We want to make sure we're doing it at least twice a day. And do it, you'll see benefit within the first week. By the second week, you're gonna be feeling really good. Right after you do this, most of our clients have more than 50% improvement right after they've done these exercises. So make sure you're consistent, and make sure you leave a comment or a question below. If you need more clarification, we're gonna get back to you as soon as possible. And you're gonna lead us into the next videos that we do, because we wanna help our people on the channel make sure that they're getting long-term results and relieve their sciatica pain. Okay, number 4, we loosened up that nerve going down. Now we need to actually make it glide. So we're gonna do something we call the active pigeon. Some really important factors with the active pigeon is we don't want the spine moving around, and we don't want to twist up. So when I come down on my knees right here, if you can't get on your knees, I'm gonna give you an alternative, but right now this is the best exercise that you can do, is get that nerve gliding. So I'm gonna slide this left leg underneath the right, and then I'm gonna slide my body back, and I'm coming down. My spine, I'm not extending in my back, and I'm not folding over. I'm also not pushing into that hip muscle. I'm not pushing for that stretch. It's really important that we don't do those things, because those are gonna be counterproductive. We're moving too much through the low back. So I'm just gonna do this 5 times. What I'm gonna do is I'm coming back straight. If you can only get back to here where you feel a big stretch, just stay right there, and we'll sit in this position where you feel that stretch. And then I'm gonna deliberately, I'm holding it for 5 seconds, and I'm gonna deliberately use my glute to push me back up and it's gonna take 5 seconds, then I'm coming back down, and you'll be able to get a little bit further each time. And you're gonna see that, but it's called PNF stretching. And what it does is it loosens up that muscle because we use it. So I'm coming back, I'm not twisting up, I'm not folding up. We gotta make sure the elbows bend. I sit down in that straight down with my pressure for 5 seconds, and then 5 seconds, 1, 2, 3, 4, 5, driving back up, and then I'm gonna drop back down a little bit further, and I'm gonna totally relax all these muscles in my thigh, in my hip, and maintain this position. I wanna keep my back in a neutral position, and I'm holding that now 5 seconds, deliberately using those muscles to drive back up. If you can at this point, we can start getting that leg over a little bit more. Just make sure it's not hurting your back, hurting that sciatic nerve. We're getting to the edge of where we're starting to feel that nerve, but we don't want to push to where it's causing any pain. I'm sitting down into it, and now you can see that I'm starting to get tight right here. I'm gonna relax down into it, back's in a neutral position, and I'm doing it for 5 seconds, and then now I'm deliberately driving back up. And then I'm coming back down for my 5th time, just totally relaxed down into it. I'm putting some pressure down into this left hip, and then now deliberately driving back up. And now I'm gonna come together and I'm switching sides. And now I'm tight right there, holding it for 5 seconds. Deliberately using those muscles right here in the glute to drive me back up. You'll see I get a little bit further that time. Breathing, relaxing, just allowing that body to move. I'm driving back up using those muscles, and I'm gonna get down a little bit further again. And I'm just not chasing that stretch to the point where I'm twisting up. I got it down for 5 seconds, and I'm driving back up. And then I'm coming back down, just relaxing all those thigh muscles. This feels really good. As long as it's not causing you any pain, it's gonna be positive. We wanna do 5-second holds. We wanna do 5 seconds driving back up using those muscles. We're gonna do it 5 times on both sides, so it's really easy to remember. We're gonna be extremely consistent with this. We've always got to loosen up that muscle tissue first. Loosen up the muscle tissue so the nerve can glide around, and then we're gonna use the muscles and get that glide back. You do this consistently, it's gonna work. You're gonna feel a lot better. We have so many clients that deal with lumbar spine pain and also sciatic nerve pain, and they're all successful when they're consistent with this exercise routine. So let's make sure you're consistent. Leave a comment, let us know if you need more clarification. We'll go on to number 5. Hold on. We're not on to number 5 yet. This is a caveat for number 4. If you can't get down on your knees, we don't want to cause knee pain if you're having sciatica pain. If you're already having some knee problems, we don't want to irritate that. So we're going to grab a chair, and this is our alternative for doing that active pigeon. What we're going to do is we're going to get this chair right here. I keep my back in a neutral position right here, and I'm just resting with my spine in a neutral position. I'm gonna sit there for 5 seconds, and I'm gonna drive my foot down. So I'm using these muscles. I've got to use these muscles in the glute, or I'm not gonna get any further. So now I'm coming down for 5 seconds, coming back up, using those muscles. That was too fast. I'm gonna come down into it. Breathe and relax, not chasing that stretch, not twisting up in my back. I'm holding that. Now 1, 2, 3, 4, 5, and then dropping back down. Same thing, 5-second holds, 5-second push back up. We're gonna do 5 of them on each side. You can do this on your bed. You can do it on the couch. We wanna make sure that we're getting that glide and we're getting that nerve moving around, and we've gotta do that consistently. We're teaching your nerve that it's okay to move again. We can take that stress off of it and make sure that we're getting long-term improvement with this. So remember, we're rolling out, loosening up that muscle tissue, and then we make this nerve glide. Now we're ready for step number 5. When we're setting up for this exercise, we want to make sure that we're our foot length away from the wall. So whatever size your foot is, the wall would be right here. So imagine that this is the wall right here. I'm going to go my foot length away from the wall. So how I would measure that is by putting my other foot forward and then sliding over. I want to think about where my toes are going to be in my shoe. That's the length I want to go, is my toes coming forward, and then I'm going to reach back to the wall. So now we'll show you against the wall right here. I'm going to put a chair right here because I want to think about your lower leg as like a stake driven in the ground. Have you been camping before? If you've been camping, then we drive those stakes into the ground. We don't want the tent to fly away when the wind starts blowing. So we drive those stakes in the ground, we hold it down, and it's stable. Our lower leg is like a stake driven in the ground. It's got to stay stable. So I measure my foot away from the wall where my toes are. I'm going to put a chair right here where it's touching my lower leg right here, right below my knees. Now my face is going to stay in line with my chest. And so if my face doesn't stay in line with my chest, then I start extending and I'm using my low back, and that's gonna wreak havoc on your low back. It's gonna hurt a lot, and we don't want that. So I'm gonna keep my face in line with my chest. I'm reaching back with my butt, and you can see that I'm not pushing into the chair. If I start pushing into the chair, then I know that I'm not doing this exercise right. I start pushing into the chair, and then I start to crimp up in my low back. I start using those low back muscles. I'm putting pressure on my knees and I'm putting pressure on my lower back. I want to make sure that I get this chair up against them. I keep my face in line with my chest, and then I'm pushing my butt back. And it helps our clients a lot to hear we're pushing backward and pushing forward with this. This is called a hip hinge squat, but it's closer to a deadlift. We should not be having pain when we're doing this. If you are having pain when you do it, you come closer to the wall and you do little bitty motion, the same motion, going back with the hips, forward with the hips, back with the hips, forward with the hips. And then now if I can do it, the full range of motion, then I'm going backward with the hips right there. I'm almost parallel with the ground right here. And my face never leads. I don't lock my eyes on anything. I'm reaching back with my butt, forward with my butt, back with my butt, forward with my butt. And so I'm teaching my body how to move in a good neutral position, and I'm getting that nerve to glide all the way up and down the chain. So it's going all the way from the bottom of my feet up through my glutes without getting pinched in the low back. You do this effectively, we're gonna pull that tension that's all in our lower back, we're gonna pull that tension down into our hamstrings and our glutes, and then we're gonna also get that nerve to glide around, and we do it consistently. This is the crux. This is one of the most important things that you get when we're fixing sciatica problems with our clients. They get this down, the quicker they get it down, the better they're feeling, and it's downhill from there. So really work on this exercise. Really make sure that you're understanding your form. If you need more detail on it, just leave a comment below, let us know, and we can do a deep dive into the hip hinge and all the positions that we see, the problems that we see. Another problem that I would say in this video is that when people come to the top, they want to squeeze their butt. But what ends up happening is they come to the top and they squeeze their butt, but what they really do is they hyperextend in their low back. And they're just tapping that nerve, constantly tapping that nerve. We want to make sure that we're not tapping that nerve. So I'm going back like this. I come up to neutral, and then I come right back again. And then I get up to neutral, back again. Your glutes should be fired up, and you should be using them a lot, much more at the bottom of the hip hinge and the back of it than when we get to the top. So you don't have to worry about squeezing them at the top. And I see this as a comment by people all the time in exercise classes and everything, is that they want to squeeze the butt at the top. That's the wrong time to do it. You're squeezing the butt as you're going back. This is when it's the most loaded. So make sure we're doing that. And we want to do 2 sets of 15, making sure that we're getting that movement pattern down. And we're going to do that consistently. So now you got 5 things that you're doing. So you're going to roll out the glute. You're going to roll out the hamstring with the lacrosse ball. We're going to use that rolling pin to get through the calf and loosen that up. And then we're going to do that active pigeon, or essentially a glute stretch, where we use the muscle. And then we're going to do our hip hinge, where we're teaching our body how to stay in a neutral position with our spine, but fire up the glutes and the hamstrings and take that stress off of our sciatic nerve. Make sure that you subscribe to the channel and you get updates on exactly what we're doing with our clients, what works here in the clinic, and what's going to help fix you. And leave a comment. Let us know if you need a deeper dive. We'll make sure that we get you that information. We'll see you in the next video.